guest right now, and he is from the Colville Confederated Tribe in Washington State, and he is Andy Joseph, and he works as
I'm the Health and Human Services Committee Chair for the Colville Business Council, and also chair of the Northwest Portland Area Indian Health Board, and sit on the National Indian Health Board and the Executive Committee.
Right. So what brings you to NCAI?
I'm here to push our Indian health type issues forward, our resolutions that we passed at the ATNI, Affiliated Tribes of Northwest Indians Conference, and anyway we move them through the committee here, the health committee.
And so, what are as you know, health worker or actually an expert, I would say. You've been in this field a long time. What are some of the pressing issues when it comes to health? I know that that a lot of people are looking forward to the reauthorization of the Indian health care reauthorization bill that was part of Obamacare, because everyone knows that in Indian country, especially with the Indian Health Service, that the funds were always short. We never had enough money to really raise the health of our Native people to where it should be. But is that an issue, and what are some of the other big issues that NCAI is working on as far as health?
Well, the Affordable Health Care Act allows tribes to get insurance for their members, and then when they have this insurance, they're able to bill that third-party money, and it will generate more money so that the Indian Health Service won't have to, with their limited funds, they'll be able to stretch it out further. So it's really a benefit to sign up for insurance. Let's say if I'm insured, and if I go to the IHS clinic, if they can bill that insurance now, so it saves Indian Health Service purchase and referred care dollars that they can use on somebody that might not have insurance.
And over time, that could mean millions of dollars to a particular hospital on the reservation or a clinic.
Yeah, it does. It will save a lot of money. It's one of the problems that I see is that there's not enough staffing in Indian health clinics, and if we had more providers in our clinics, then we could really, I guess, take advantage of the Affordable Health Care Act a lot better for our people. If you only have a few doctors trying to funnel them through, thousands of patients, that becomes a problem. So.
Right, and that's been a historical problem. Yeah. Let's talk about some. The diabetes seems like it continues to just ravage our Native people, and we see that even our young people now. What is it, type 2, that seems to be the one that is affecting more and more of our people?
Well, there's a program called the Special Diabetes for Indians program, and it's had to be reauthorized every year for I think the last 4 years, and it's really hard on tribes when if you work for that program, you don't know if you're going to get paid the next year, if it will get authorized or not. So I know Senator Tester and Senate Committee on Indian Affairs is asking for a permanent reauthorization of that program, and I really support that, but I would hope that it would be put into a mandatory spending bill so that it will get increased every year, because our people multiply quite a bit, so there's more of a demand. In my tribe,
I like the way you put that. They like to multiply.
In my tribe,
I hear what I can read between the lines. Okay.
in my tribe, we found out with that money how many people were pre-diabetic and how many were actually had diabetes, and just by knowing that, by changing our diet and doing more activities, it's lowered the amount of people that have diabetes. So it's a really good program, and if the government was really smart, they would invest more money into that program to prevent having to do the amputations, the dialysis, just the cost for people to travel to go get that dialysis is really expensive, and some people can't afford the gas to go there and get that treatment. So,
yeah. You know, the other thing that really breaks my heart when it comes to a health issue is the suicide rates. And I think Colville has had more than its share of suicide, especially among our young people. But you know, how is the National Indian Health Board looking not only at funding, but staffing, but also looking at maybe it's a mental. There's lots of different reasons. I've heard bullying is come into the public eye now. But what can we do to really get the attention of? And it's not just the youth that need to be counseled. Sometimes, I mean, it's the whole family. Sometimes it's the whole community. What are your thoughts when it comes to preventing suicide attempts, especially?
What we need to do is with the grants that we get, and we need to change the policy to allow our tribes that receive grants dollars and to have our mental health counselors be able to use our traditional practices as much as possible. A lot of our young people, some of them went to boarding schools and they wasn't really trained in their cultural teachings because they were kind of forced away from like learning their language and part of the language has to deal with your cultural upbringing. So when you take that away, it really impacted our people. You got a lot of young parents that never got that cultural training. They were taken away from their families. Their grandmothers and parents weren't really able to take part in their upbringing. So there has to be a parenting classes that involve counseling that teaches our traditions and customs of how we're brought up to respect who we are and also the environment around us. The animals, the foods, the medicines, the water, the earth itself, and respecting our elders and our own bodies. So that's a big part of what I believe would be more beneficial. Mm-hmm. Kids they want to get their attention, and they'll try to get it in ways that they'll harm themselves or harm others. It's really a hard time.
Yeah, and you mentioned that, and I heard you saying that within a lot of these federal grants, even state grants, they're not allowed, right? I mean, it's almost like, well, if you can't allow traditional people and traditional methods of healing with this grant.
Yeah.
What can tribal governments do to be proactive and say, you know what, this is money that we're eligible for. We want to change the standards here, and so how can tribes become more proactive and say, you know what, we there's no doubt that we need the funding, but let us do it our way, because this is what we've seen that can help.
Well, in the Northwest, on the coastal side, the tribes on the coastline, they have what they call the canoe journey and the canoe families. And those families, in order to be a part of it, you have to prove to yourself and prove to your canoe family that you're on the right path, and they'll help you get to that path by learning their songs and their dances and their ceremonies. On my side of the mountains, we have our different tribal ceremonies, either in our longhouse with the Washit religion or our spiritual winter dance that we have, and just the everyday upbringing of a young tribal person, learning the ways gathering gathering their foods, and honoring them, honoring the spirit that's in the food and the water and the land, and learning how to take care of themselves, and actually giving back to their community. It's a real honor to be able to do that for your people, and in a traditional way, elder would put you in the spotlight then and say, "This is my grandson," or "This is my granddaughter," and I'm so proud of them for helping me, or helping the rest of the community. So.
And that has a way of building self-esteem within that young person.
That young person will grow up wanting to get that same kind of acknowledgement as he grows up, and they'll remember that, and then they'll pass that on down to their children and their grandchildren. That's that part that was taken away from us as going to boarding schools. It's a better practice than going to, I guess, being forced to go to AA camp or into other different
programs that
just make you mad. It makes our tribal people mad, and because it's just preaching kind of like to them, and not asking them to be a part of who you really are.
I like that. Anything else you want to add as far as health issues and something that I might not have asked you, something important that you want to say to our viewers?
Well, some of our we've lost a lot of really good tribal leaders that I've seen in the past, and a lot of times their tribes think that you come to these meetings to have fun, and in reality it's a lot of work. Like, for instance, coming here, I was cramped up in a plane, and I couldn't really move to take and stretch out my body.
And that's a long trip.
And it is a long trip.
What was it? So you fly to Seattle? Where'd you fly?
I flew from Seattle to get to here.
Yeah.
Anyway, the time zone change is really stressful on your body, and but the meetings are really long. We started meeting this morning at 8:30, and we didn't get done till what time is it now? Around 6:30 or
10
so.
o'clock. It just feels like, well, no.
But it's long days, and I always say that IHS has 12 different regions, and it's like they don't get fully funded. So when they put out the different funding, it's like I always say it's like a litter of 12 puppies, and the puppies that are in there getting the scraps, when you throw them out there to them, they're the ones that's going to bring home the resources that will help your people the most. And it means saving the lives of your people when it comes to the Indian Health Service. So it's really important that you have your representatives there, and if they're not there, the government and all the different programs are trying to, bit by bit, they'll try to take something, kind of responsibility away from you, or away from themselves.
Right.
And that's something that you got to be there to protect. It's their trust responsibility to look after us. But if they can get away without doing their part, then they'll think that it's okay. So you lose ground. So it's our jobs as tribal leaders to be there for our people. It's means being away from home a lot. I love my job, and to me, it's important enough.
You got to get that milk.
I believe
bring home the milk.
I believe we're saving lives, and it's terrible to have to go home and bury so many of our people because of the lack of funding that the IHS gets. And we got to do our part in lobbying Congress and getting the attention of the president.
And we've got to get the Reauthorization Act.
We have to get
signed before Obama. And even if that happens, we don't know if the next administration is going to strike it down or whatever.
I worked in the last administration, and we were told to work on a 2%, a 3%, and a 5% was Bush money. Under the Bush administration, we got the biggest increase. Under the Obama administration, we got the biggest increases that I've seen in a long time. The purchase of referred care used to be called contract health services dollars. That's where the purchase orders come from, and it increased about 48% from what it was. That was a real big need in Indian country. They're still short about $880 million in that one line item. So, and the overall IHS budget, what they really need is $28.8 billion. We're lucky we're not even, we're still under $5 billion. So that's how far the government is behind on providing our health care to meet the needs that we should be receiving.
And prisons get way more.
Oh yeah. Right? If you're in a federal penitentiary,
people don't know that. They're like, $5 billion. What are you talking about? Well, what do prisons get?
They get twice as much as what a Native American would get in health care.
That's true.
I don't want to go to prison to be able to have an open heart surgery.
Well, yeah, there you go. Yeah. If you need a real health care, go rob a bank or something, and maybe you'll.
You need real dental care. The prison might fix you up, but in Indian country they'll pull your teeth.
Okay, Andy, thanks so much. We appreciate you stopping by, and we appreciate the work you're doing, and hope you get a bigger seat on your way back to Seattle.
Oh yeah.
Okay.
It would be nice.
Okay.
Thank you.
All right. Thank you. Tell the people back in Colville I said hello.